Did you know that both a 150-pound Great Dane and a 5-pound Yorkshire Terrier will receive the same dose of vaccination? This might be one of the reasons why it's scary, or maybe you've had a pet who's had a vaccine reaction or even possibly died from a vaccine. Vaccines can be really scary, but they don't need to be, because when we actually look at how to properly and appropriately vaccinate our pets to ensure immunity, the game changes. There's a lot of different vaccines out there now, and companies are coming up with new technology to keep our pets safer and healthier. And the diseases like distemper and parvo are still out there, especially in wildlife population. So we need to look at how do we boost our pets' immunity? How do we protect them? And how do we keep them safe? Because we want them to be with us for as long as possible. So I'm Dr. Katie Woodley, the natural pet doctor. This is our weekly coffee talk with the doc. We do this every week. And today we're talking about vaccines. I'm going to talk a little bit about the brief history behind vaccines, what vaccines are, why we use them, and then we're going to go into why people are worried about them and why, yes, we are over vaccinating our pets as a general theme in the veterinary community. But the best part about this is that we can change that. And you as a pet parent, I'm going to give you some tips and things that you can ask from your veterinarian, like vaccine titers, instead of having those vaccines done every single year for your pets, because that's not appropriate. And we have other tests to make sure that your pet is protected, has immunity against developing things like distemper, parvo, and they don't necessarily need to have vaccines every single year. And you don't have to worry that every time you take your pet outside that they're going to get sick. So that's why it's really, really important. I'm not against vaccines. Yes, I'm a holistic veterinarian, and I'm fine saying that. I'm against over vaccinating our pets and causing harm to them when we have a better way forward. So why do we do vaccines, right? We do vaccines because vaccines are going to help produce immunity in the body if our pet comes into contact with a virus or even bacteria like leptospirosis, Lyme disease, there's vaccines for. Now, just because we have a vaccine doesn't mean your pet should have every single vaccine. That's a key thing. Just because we have Bordetella vaccine, does your dog actually need the Bordetella vaccine? Do they go to the dog park? Do they go grooming? Do they come into contact with a lot of other animals? If the answer is no, then don't do the vaccine. So we have to assess the lifestyle of our pets, the risk to benefit ratio. Is it worth giving an additional vaccine to that pet to protect them? Or are they not going to potentially come into contact? Or is that disease mild? Is it going to be a mild disease that your pet is most likely going to be okay? Bordetella is one of them. A lot of dogs will still develop kennel cough even with that vaccine. It is not for sure you're not going to get it. I worked at a clinic where we had a doggy daycare and the dogs would still get kennel cough. And it wasn't like we weren't cleaning, we weren't doing things properly. It's just that's how that vaccine doesn't provide 100% immunity. And that's important to remember. So with the body and the immune system in our pets, and it's very similar to ours and how it works when we're fighting an infection or we're giving a vaccine. So there's two types of an immune system. So we have our adaptive, which we're going to talk about because that relates to our vaccines, our immune status if we come into contact with viruses. And in that adaptive immunity, then we're going to have the humoral. So this is what produces those antibodies that we can actually measure in the body through titers, which we're going to talk about, this is why like everyone here needs to be listening up and asking for these from your veterinarian. And then we have our cellular immunity. That's all part of this adaptive immune system. And that's a cell mediated immunity. We can't measure that titers don't measure that. And so those are really important parts for memory cells being made. We have our T cells and our B cells that are produced when they come into contact with an antigen. An antigen is like a foreign thing that comes into the body, whether it's through natural exposure to a virus or the antigen that's present in the vaccine. So let's say parvovirus. If we have a modified live vaccine, and there's different types of vaccination, like vaccines out there, parvovirus tends to be a modified live or a recombinant vaccine. If it's modified live, they're taking that virus, the parvovirus, they're weakening it. And then, so that way, when they inject it into a healthy pet, remember I said healthy, we only should be giving vaccines when healthy. So if your pet is sick, they're itchy, they have diarrhea, they're not feeling well, they're having anesthesia for a dental, they should not be getting a vaccine. They are not technically healthy, because if we give a vaccine and we stimulate an already overworked immune system, we will run into problems. It may not be that day, it could be later. So keep that in mind. If it's the booster is due and your pet is sick and you're at the clinic, it is not worth the risk to your pet to give that vaccination. So let's go back. So we have the parvovirus, it's weakened, it's in this modified live vaccine. This is what we inject into the pet. So typically a puppy, and it's stimulating B cell production, T cell production. And then what happens over time is we have memory cells that are made. Those memory cells then are contributing to what we call the immunologic memory. So now your pet's going to go outside. It will come into contact with parvovirus. It's in the environment, it's everywhere. And it lasts for like over 7 years in the ground. It is a very hardy virus. Your pet will come into contact with it. And when they do, we are relying on those memory cells to kick in and go, hey, nope, we're recognizing this foreign antigen, but guess what? We have the protection. We have those fighter cells that are going to kick start and start helping the pet not develop parvovirus disease. So what we've done is we've created this strong immune system, this strong shield, so that your pet, even though they will come into contact with parvo and distemper in the environment, do not get sick. That is the goal of those vaccines. So that's why vaccines are important. Now, we have core vaccines, we have non-core vaccines. And with our core vaccines, so that's for dogs, we have distemper, we have parvo, we have your rabies is one. Adenovirus is technically a core vaccine. However, we haven't had canine adenovirus in over 15 years. There was one case of it, and that was it. And we can use other vaccines, which I'm not going to go into today, but we can use other vaccines like Bordetella to help stimulate immunity, cross immunity for canine adenovirus. And there's some reasons why we shouldn't give that. We talked about that during our vaccine webinar that we did this week. So catch the replay. It's good until Sunday if you still want to learn a lot more about that. However, the biggest thing is when we're giving these vaccines, so our core vaccines, your pets, your puppies need to have these core vaccines. It doesn't mean that they need to have 5,000 different vaccines all at once. That's not the right way to safely and effectively vaccinate your pet. But the thing that a lot of people don't realize, and there is a lot of fear surrounding vaccines, and I totally understand that, is that with these core vaccines, so distemper, the parvovirus, when we give that and the maternal antibodies, so that's the stuff from the mom's milk, because those last up until 10, 12 weeks usually, they are waning, and we're giving this boosters to our puppies and our kittens because those maternal antibodies will block some of the protection from the vaccines that we give. But we don't want to leave them open to potentially contracting parvo or distemper from their environment because they may not have enough maternal antibodies to protect them. So that's why we do these series of booster vaccines for your puppies and your kittens. But the thing is that these core vaccines, your distemper, your parvo, your panleukopenia for your kittens, your cats, usually one dose when those maternal antibodies are gone from the body, one dose gives lifelong protection to that pet. Numerous serological and challenge studies by Dr. Ron Schultz and Dr. Jean Dodds have shown that over and over and over again. So the problem that we have then, okay, we've vaccinated our puppies and our kittens. So typically for dogs, 9 to 10 weeks of age, they're getting the first one. They're getting a booster in 14 to 15 weeks. Kittens, 8 to 9 weeks, because studies have shown that they are actually not protected. Their maternal antibodies wear off up to 2 weeks sooner than a puppy. And then we're boosting those vaccines from 12 to 13. And then we're giving the rabies later. As much as possible, we can push that off. So typically we can give rabies at 16 weeks of age, but if we can push that to 20, 24 weeks and then give that separately, because it's a killed vaccine. And killed vaccines will have an adjuvant added to them because that virus has been killed by chemicals or radiation, so that it doesn't potentially revert and cause the rabies disease. We don't want that or need that in our pets. But the thing is with killed vaccines, and this is where rabies is the #1 for causing vaccine reactions, which is, we see it all the time. Your pet doesn't feel good. They're lethargic. They might lose hair in that area where the rabies vaccine is given. Who's ever had that happen to their pet? Or worst case scenario, we have a hypersensitivity type 1 reaction and your pet goes into anaphylactic shock. They're vomiting nonstop, usually while you're at the vet clinic, minutes after we give it. Within 15 minutes of giving that vaccine, they may collapse, their blood pressure drops, and that's when we have to give steroids and get them on fluids and support their blood pressure, and it's a true emergency. So those adjuvants are added to stimulate the immune system, but they can come with potential side effects like that. And that's why we see more adverse effects. That's why we have to give, or we should be giving that separate from those other vaccines, because of the higher risk of something happening. That's really, really important. So we want to push that rabies out as far as possible. So then what happens, right? We have this maternal antibody that the puppies and the kittens, they get from, hopefully they get from the mother. Sometimes they don't, or the mother didn't have a lot of antibodies against parvo, distemper, may not have been vaccinated previously. They might not have been exposed to the virus, whatever. They may be an immune non-responder. That can happen too with genetics. And they don't have those antibodies to pass on to the puppies and kittens. So then we have, hopefully, okay, let's say healthy mom produces puppies. They're on the mom getting milk until like 6 to 8 weeks, right? As long as the mom will let them before they go to their new homes. And so we have these maternal antibodies that are up here, and then they're waning. So they're decreasing. And this is where we start giving those vaccines, and we're increasing those puppies and kittens' true antibodies in their immune system. So we're stimulating B cells, T cells, in that humoral immune system. And then they're creating that cellular mediated immune response, and they're developing those memory cells. So that immunologic memory that we talked about at the beginning, where if they came into contact with that disease, they should be protected. But how do we know those pets are protected? This is where the problem lies. Most pets will develop an immune response. Some pets don't. They have a genetic trait. They're non-responders. You can vaccinate them over and over and over again, and they will never develop those antibodies to those diseases. So this is where titers come in. And titers are not run enough in the vet world. They're not. And it's because you are not educated about them. And hopefully that's changing with vet schools now. Currently, I'm hoping that's changing with all the studies we've had. We've had studies since 1978 with Dr. Ron Schultz. He's been doing these tests, serological testing, challenge studies with dogs and cats for years and years to showcase duration of immunity. So DOI is longer than 1 year and even 3 years. So vaccines, it's super confusing, right? You go in and you're like, I got a 1-year rabies. What does that mean? Oh, it lasts for 1 year, right? So they need to have a booster in 1 year. You get a distemper parvovirus vaccine. It has a label for 1 year or 3 years. You have to come back in that amount of time and re-give that vaccine and booster the vaccine. However, studies show that especially with distemper, parvo, panleukopenia in cats, that the duration of immunity is 7 to 15 years. but how do you know your pet is a responder? So that is the key, is you need to be testing through titers to know if your pet is responding. And this is the thing and that we need to look at. There are titer tests that vets can run in clinic to showcase. So we're looking at humoral response, the antibody mediated response. So this is checking for your memory T and B cells to showcase that your pet has that and can mount an immune response. Now, some people will use homeopathic nosodes. So this is where you may, this is what's really hard and difficult. And I have nothing against homeopathy, and it works for so many pets and people. And I highly recommend working with a homeopathic vet if you're doing that. But the biggest thing is we can't measure through titers if your pet has an immune response with that. So that makes me nervous that I'm telling them that they're safe and they may not be. And so that's the thing. And also with other studies, Dr. Jean Dodds has done a lot of studies showing that the homeopathic nosodes through tests with dogs at a kennel facility, they introduced parvovirus in the study, and they were on the nosode treatment plan, and the majority of them developed parvo. And it doesn't mean it doesn't work, but it just makes me nervous. So if you're going down that path, work with those people that have been doing it for a long time, have well, not necessarily the research, but they have the case studies behind what they're doing to make sure that you're hopefully keeping them safe. Now, the other thing is too, and Chris, love that you're bringing this up. I know we've been kind of going back and forth with information. Naturally acquired immunity is another thing. The thing about that, what worries me is if you are going through gradual environmental exposure, and correct me if I'm wrong, but if I go to the park, I don't know the amount of toxin, the viral load in the ground, and that pet could potentially get too much of it and they're going to get sick. So that's where doing the titers, doing 1 to 2 vaccines for your puppy, your kitten, using recombinant vaccines that don't have adjuvant. So they're going to have less chance of a vaccine reaction, and then titering them. Then you know that your pet is safe and healthy without potentially exposing them to deadly viruses. Distemper kills pets. Parvo kills pets. And we don't see a lot of distemper in the US because 50% of dogs are vaccinated for it. You go over to, say, Ecuador, you go to a third world country, they have multiple distemper cases every single day. And watching seizing pets is not okay when we have vaccines that can protect them. But the problem is we're over vaccinating. And I know I'm getting like heated because I see it over and over and over again. My vet told me I had to give this vaccine. My vet did it every single year. That's not okay when we have these titer tests to showcase if your pet has antibodies. So let's say, okay, we do the puppy vaccines. They're protected at 15 weeks. And let's say, okay, maternally derived antibodies have worn off. Sometimes these pets don't mount an immune response. You can wait 3 to 4 weeks after giving that last vaccine as a puppy, and then you can check a titer test. And you can see, did this pet respond to those vaccines that were given to them? Now, you don't want to do this before 16 weeks of age because you may pick up some of these maternally derived antibodies, and those aren't a true representation of what's in that pet's body. That's really, really important because those are going away. They're gone. So if we're like, oh, they're safe, but they're not, wait. Even if you waited a little bit, that pet will still have antibodies, even if you waited that 24 weeks. So we can do that for distemper. We can do this for parvo. We can do this for panleukopenia. And keeping in mind those serological and challenge studies done by Dr. Ron Schultz since the 1970s, and he continues to do them with Dr. Jean Dodds, showcase that these vaccines last for 7 to 15 years. The goal is that a pet only has like 2, 3, 4, 5 vaccines at most throughout their entire life. So that's really, really, really important. And making sure that we're protecting them. Because like I said, parvo, distemper are deadly. And we can protect them. Now, the downside with rabies, so rabies is a killed vaccine, right? And it has the adjuvants, and it's the number one causing adverse reactions to our pets, but we're legally required to give it. Now, the cool thing is there's a rabies challenge fund that Dr. Gene Dodds and Dr. Ron Schultz actually just they completed it. They weren't able to finish the last part because the USDA didn't have challenge species. So that means rabid animals to reintroduce potentially to these dogs that have been going through, that have been given the rabies vaccine, to challenge them to draw blood and see what is their serological status. Do they mount an immune response? So they're not able to get the CDC and the new label requirements to showcase that the rabies vaccine lasts longer. But they've shown that the rabies vaccine can last 5 to 7 years, probably more. But when that finishes, when that study changes, it will change everything. It will change the label, where rather than doing a 1 or 3 year rabies vaccine, vets will legally be able to give that vaccine every 5 to 7 years. Game changer. Puppies and kittens, they get the like 20 to 24 week rabies vaccine. You can titer test too. States they won't accept it. That's the problem. We're legally required to give this vaccine. And that is the frustrating thing. But still, do not give that vaccine if your pet is sick. And that's, if you're a vet and you're listening to this, like it says on the label, only give vaccines if your pet is healthy. Healthy pets. A healthy pet is not an itchy pet. It's not a pet with diarrhea. It's not a pet having anesthesia, getting dentals. That is not the appropriate time to give vaccines. And I've had multiple people reach out to me and tell me, I had to give a rabies vaccine to my cat because the vet wouldn't see them. They weren't up to date. And the thing is, weeks later, they were sick, but they wouldn't see them. And they gave the vaccine, and weeks later, the pet passed away. There was most likely part of that was because of the vaccine, unfortunately. And we have to change this. So this is where, yes, we can't count a rabies titer test as being the thing to avoid vaccines, but this is where a rabies titer test can help you as a pet parent and can help vets feel safer, is that we can do these rabies titers. Yes, they're super expensive. They're only done at Kansas State University. But when we do that rabies titer test, we can look at the number. So usually they're going to say for international travel, that's where most people are doing this for their health certificates for their pets. They say 0.5 international units per mil is high enough for your pet to be good to travel and get into the other country. However, the CDC states that the rabies, you are immune, you have immune protection from rabies at 0.1 international units per mil. This is for people. So for me as a veterinarian, many vets have to be vaccinated against rabies. They go and get titers instead of boosters. Hello, why aren't we doing this for pets? We do it for ourselves, right? So we go and we get a titer done. And if we're at 0.1 international units IUs per mil or higher, we don't need a booster vaccine. So, okay, with that information, if your pet has that level, then what you can do as a vet, as a pet parent, if your pet has cancer, if your pet has allergies, if your pet is sick, you can go, you know what? Let's hold off. And hopefully if you're in a state where the vet can write a waivers form. So in Colorado, I can write waivers. If I have that titer test, I feel good knowing that this pet is protected if you came into contact with a rabid raccoon, a fox, skunks, they all carry rabies. They can, and they can also carry distemper. And so we have these wildlife reservoirs, unfortunately, of disease that our pets can come into contact with. But with that titer, I know this pet's probably protected. I don't have to like kill its immune system that's already overworking, and I can write a waiver. Or you can look at that and go, oh, okay, well, let's wait. Yep. Okay. Your pet's sick. Let's fix that first. And then we can do the rabies vaccine when they're healthy. So it gives you peace of mind knowing that your pet feels good. So now the other thing is that you're asking. So the other thing with rabies, actually really quick, is so we have 1 year and 3 year rabies vaccines. And we should, so your puppies and your kittens will get 1 year. They get a booster at 1 year after getting their puppy and kitten rabies vaccine. And then make sure at the 1 year after puppy and kitten vaccines, your vet is using a 3-year thimerosal-free, so mercury-free rabies vaccine. There's so many companies that have the thimerosal-free. We should be using that for every single animal, especially cats. We're not even going to talk about injection site sarcomas, but that's a huge problem with cats. So we need to be using less junk in these vaccines that cause all those issues, which is why, so that's why we hate vaccines. Over vaccinating causes issues. It's the adjuvants that are creating problems and overstimulating the immune system, leading to autoimmune problems and other things. So this is where making sure that vets are using the 3-year labeled products and not doing every year. Let's stop focusing on, you know what, your pet's due for a booster vaccine. No, your pet is due for its annual wellness exam. Like, let's make sure your pet is healthy, and we're doing an exam. Like, I need to check your pet. The amount of times I picked up heart murmurs, that I felt like arthritis, that I've picked up a mass in the abdomen through an examination on a healthy pet, like the pet parent had no idea there was an issue because the pet didn't show any symptoms. So we need to stop calling it a booster appointment. It's not. It's how do we help support your pet to prevent disease and maintain wellness? That's really important. One of the confusing areas for veterinarians with titers is that you'll see ratios a lot of times. So if I send it off to labs like IDEXX, CSU for titer testing, it'll come back with a ratio. So it'll be like 1 to 64. And you're like, what the heck does that mean? Or 1 to 5,000. And vets are like, just tell me, like, is this pet protected? And it's very difficult. But the thing is that we can ask veterinarians, if you're listening, get VaxiCheck, get Titer Check. These are tests that you can run in-house in 20 minutes. Your pet parent's sitting there with their pets, you draw the blood, you start running it. By the time that the appointment's almost over, you know if that pet is protected. It gives you a yes or a no. It doesn't give you this ratio that now you have to interpret like, oh, but they say it's not protected, but it's still showing up. Anything that shows up shows that pet's protected. That's how memory cells work. If they are at 0, then we have a problem. That could be a non-responder. That's when you need to give a vaccine, and then you would recheck a titer in 3 weeks. So there's a lot of ways to work around that, but that's really important. And as pet parents, if your vet doesn't run titers, ask for VaxiCheck, ask for Titer Check. Be like, you know what? I listened to this webinar from this crazy holistic vet, and she said you can get this into your clinic and you can utilize this and we can find out right away. And I'm willing to pay more so I can protect my pet. I don't even know what the cost is, to be honest, but I don't think it's much. And it's so much, it is so worth it if it means that you're not over vaccinating your pet and causing further issues down the road. So this is a great question. And far-fetched vet student, I love that you're here. And it makes me really sad that they didn't talk about titers during your immunologic class. Like, oh my gosh, that makes me so sad. However, okay, this is a great point. Shelter medicine is definitely a gray area. So for protocols, because of the nature of high intake and other, they're higher risk. So we have things like calicivirus. We have, for cats, we have all the upper respiratory herpes virus, panleukopenia. We have for dogs, kennel cough, all those things. So shelters are completely different. And that's where we usually start vaccine protocols sooner, typically, hopefully not before 6 weeks of age, because some of these vaccines can lead to severe side effects, seizures, other problems. So we want to be careful with that, but definitely shelters are very, very different. The cool thing is too, with shelters, like cat shelters, they've actually, so vaccine technology is so developed now. Well, it's becoming more developed. There's a lot more research, which is good, because the more we ask for better results and safer results, they're going to respond. They don't want pets dying. Let's be honest, like they don't. And so the biggest thing is with cats, like we have intranasal vaccines that we can give for things like calicivirus that can help and be more effective in a high risk environment. So there's a lot of really cool things that we can do to safely protect those animals. And I love that you want to be a crazy holistic vet when you grow up. That's fantastic. We need more of you. So there's not enough of us, which is why we do this every week. And so there's a lot of things surrounding vaccines. There's a lot of fear around vaccines, but don't let the fear keep you from safely protecting your pet. Let's keep it from over vaccinating our pets. That's the thing. We don't want to over vaccinate. We don't have to over vaccinate. We have tools, we have resources to see how well our pets are protected. And it's so important. And it's, Sasha, yes, you're a vet nurse, and vets just don't understand it. And, talking about titers being a gray area, it's not. It is so not. Dr. Gene Dodds, Dr. Ron Schultz, it's just like far-fetched vet students said, we're not being taught it. We're not being taught it. And that's the problem. We're not being taught it as veterinarians. And so we're confused. We're scared. We feel like we're just protecting the pets even better if we give the vaccine, right? I feel good knowing that I'm giving you this and I don't have to worry about your pet getting sick. But when we over vaccinate, we have the opposite problem. So titers should be a gold standard at every practice. We did them at my last practice before I started my own business, and I loved it. We also carried monovalent distemper and parvo vaccines, so they weren't a combined vaccine. So we could run titers and see if this pet was protected. And if they were low, there were things that I would have changed kind of with the protocol, knowing what I know now, like doing the vaccine check and the titer check to reduce the confusion with those ratios and being, they said they're kind of low, but they're still registering. I wouldn't have vaccinated that pet knowing what I know now. I would have done another boost or another titer check in 3 years' time. So there's so much of it. And if you want more and you like the holistic medicine, I have a membership. And the vaccine webinar that we just did is going in the membership. We talked about DCM and grain-free, which is another huge controversial issue. That's in our membership. So go to our website at thenaturalpetdoctor.com, click on our pet membership, and you get the live webinars with me every single month on topics that we cover on holistic pet health, but also integrating in conventional medicine. Because there is a time and a place for conventional. I'm holistic, but I have the conventional background, and there is a time and a place where we need to integrate the two together to achieve the best results for our pets. That's what I'm about. I'm not all about disregarding everything that I know and not using all the tools in my toolbox to make sure that these pets are achieving optimal health and thriving throughout life, through nutrition, through vaccinating appropriately when and where needed, through using sometimes conventional drugs to get rid of an infection while we integrate herbal medicine, supplements, using acupuncture to help with pain control, pancreatitis, all sorts of things. We have so many different tools at our hands, and we need to integrate both sides of medicine in together so that we can heal disease rather than cover up symptoms and fix problems. You will visit the vet less, you will spend less money, but your pet will live longer. And as veterinarians, we shouldn't be afraid of that. That is the ultimate goal. That's the oath that we took, is to help these pets. So I hope that helped a little bit. If you do want more with the vaccines and titers and just everything about vaccines in general, check out our webinar replay. But if you just want all of it, go to our membership. We're going to be revamping it, and I'm so excited. So we'll be relaunching that soon, but you can still be a part of it and get our monthly webinars and be there live with us so you can ask me more questions and just be a huge part of our community. All right, everyone. So I look forward to seeing you next week. 10 a.m. Mountain Standard Time. I'm going to be releasing next month's schedule because we're at the end of the month. Happy Halloween, everyone. So send me the topics you'd love for me to cover. So every Saturday, I cover different topics, and I'd love to hear what you would like to learn and know as a pet parent to help your pets achieve optimal health. So send me a direct message. I'd love to hear from you, and rewatch this. If you feel like it'll help, it'll be posted for everyone, and feel free to share it. All right, I'm Dr. Katie Woodley, the Natural Pet Doctor. Take care.